Hi, welcome to Collateral Medical. Today we're going to see a fetal Doppler, that is JPD 100B. This is how we get the equipment out of the box. As you can see, it comes with This is the manual with the packing list. It contains the number of accessories inside the box, along with the operating manual. This is the main equipment, and which comes along with a charger. The equipment consists of the monitor, where you can see the reading, and the probe. You fix the probe into the main equipment there. Until you hear the click sound, it's not fixed. This is the volume, like higher volume and the lower volume level. So when you click on the on button, power button that is, the Doppler has started. This is the ultrasound gel that you apply on the probe. The importance of the gel is that you get the perfect reading only when there is no air between the probe and the skin. So to avoid the air gap and for proper contact, you require this gel. Okay, to give you a demo on how the readings are taken, when this probe is applied in the mother's womb, it receives pulses in a manner like this. And depending on the rate of the pulse, if it is slow or fast, the average pulse rate of the baby will be calculated per minute, and it will show on the monitor as it is seen here, which is 116. Thank you for watching the video.